Good afternoon, everyone. My name is Jen Felton. I'm one of the regional directors here at GoldenCare, and I'm pleased to be with you here this afternoon. First of all, though, if you're new to GoldenCare, I just want to welcome you to our webinar. We've got lots of tools and services to help our agents sell out there in the marketplace. So I encourage you, if you're not familiar with GoldenCare, go ahead and check us out at www.goldencareagent.com. Of course, if you're not contracted yet, give us a call. We'll help get you going right away with lots of different carriers, including this one here I'm going to show you here today. But our number here at GoldenCare is 800-842-7799. But what brings me here this afternoon is the Kemper Health home health care plan. And you can see here that Kemper, it's now Kemper Health. They used to be Kemper Senior Solutions. They are now called Kemper Health, and you'll see we've got a lot of new brochures and everything. They've updated all their materials, so everything's looking a lot nicer here with this near guarantee issue product that I'm going to show you here this afternoon. But with that, what are we going to do here today? We've got about 30 minutes, I guess, of a webinar for you. And we're going to talk about a little bit about the history of Kemper. Of course, I'm going to go through the outline of coverage and, of course, the basic plan, which includes their home health care benefit, their home health care aid benefit, their prescription drug benefit. We're going to go over some rates. They also have an optional benefit rider, and we're going to talk about those rates and benefits as well. Of course, we're going to cover the triggers of the policy and how to qualify for benefits. And I'm going to show you how easy it is to fill out that home health care application and the medical notice. And then all finish up with the states where it's approved. So again, we've got a big day here this afternoon. Let's go ahead and get started. With that, though, Kemper has actually been around for quite some time. They've got over $11 billion in assets, and you can see that they offer several different lines of insurance, not just the health, but they also offer life, home, and auto as well. They service about 7 million policies, and you know what? They've got a lot of agents and brokers, and only about, gosh, it's probably been about 5 years ago now that they opened it out to the independent agents. Otherwise, they used to just have career agents that were selling their products, and now since they've opened it up, it allows us here at GoldenCare to offer this valuable product to you to sell to your clients. So with that, one thing I want to point out is it's actually Reserve National Insurance Company that underwrites this Kemper Health product that I'm going to show you here this afternoon. They are rated A excellent, so that's a great solid rating by AM Best, so you can feel comfortable that they do have a good overall financial stability with this company. So with that, let's go ahead and get involved in the home health care insurance plan. Now, I'm going to show you Alabama forms. Of course, all these forms are state specific, so whichever state that you're writing in, make sure that you have the state forms for that specific state. So first of all, though, is the brochure, and those of you that have seen the Kemper product before, you can see it's no longer that yellow and orange brochure that they used to have. They have a very nice brochure with a couple on it, and it's now under the name of Kemper Health. Then, of course, you've got that outline of coverage. It is only a 3-page outline of coverage. Of course, we also have that application. There's a medical dupe form, and for those over the 65 and older, you do need to provide that Medigap policy booklet as well. So these are all the forms. Don't worry, we are going to go through all those forms independently, so you don't have to worry about it. And again, at the end of the webinar, we will email out this presentation too, so you'll have a copy of the presentation so that you have everything that you need and you can go through it later if you'd like. So again, the first thing I want to talk about, though, is the outline of coverage. And this is a nice little form. It's actually really handy for the agents as well as the clients because it really lays out all the benefits that they're getting within this home health care policy. And, GoldenCare is a big long-term care shop. We love long-term care. We believe in long-term care. And if you're healthy enough to qualify for long-term care, you should definitely buy that full-blown plan. But the reason why we like the standalone home health care plan that Kemper offers is the fact that there's very minimal underwriting on this plan. So you know what? You pretty much can sell anyone out there this home health care plan. And so we use it as a great alternative to people who want long-term care and maybe are just uninsurable. And I'm going to show you how easy it is to purchase this plan as we go through this webinar today. But again, going back to the outline of coverage, it's going to lay out all your benefits here, your home health care benefits. It's also going to talk about your home health care aid benefits, your prescription drug benefits, and then of course, it is a guarantee renewable plan, so as long as your clients pay their premiums, they can't be canceled. Again, it's a guaranteed renewable. The reason why we point out the outline of coverage is it's also a very important piece to the application process. For one, they also want the client to sign off that they know they're not buying a full-blown long-term care plan. This is a standalone home health care policy, and they do need to sign this this outline of coverage, as well as you as the agent, and return it back with the application. Also, an important reminder is you got to sign 2 of these, because not only do you leave one with the client, but you do have to submit one to the company when you do apply for coverage. So outline of coverage is very important. It's also a very handy tool because it does lay out all those benefits that we will be going over here shortly. But it's a great form to go through with your clients. So what is this home health care coverage plan? Well, Kemper's home health care plan pays up to a $150 maximum benefit for 360 days. Basically what that means is it's equivalent to $54,000. And what's nice is that you can actually sell 2 Kemper policies to the exact same person. So instead of $54,000, you can actually get up to $108,000 for those 2 policies. It's also an indemnity plan. You can it will even pay benefits even if Medicare or any other health insurance is paying. Doesn't matter. The home health care benefit through Kemper is going to pay regardless if anybody else is paying. The other benefit underneath the home care policy is the home health care aid benefit. Now, the home health care aid benefit does have some limitations to it. You can see it's going to pay $40 a day for a home health care aid to come to your home, and that is a maximum of 60 days. So 60 days of this 360-day plan you can get for home health care aid benefit. Now, also, in order to access the home health care aid benefit, you immediately must follow a hospital confinement of not less than 3 days. So this also gives you a $2,400 maximum benefit. So basically what that's saying is this $40 for 60 days is going to give you a maximum benefit of $2,400. And then you do need to have a prior hospitalization stay of 3 days in order to get home health care aid benefits. Now, one thing I do want to point out is there's a lot of states that don't have that 3-day prior hospital stay. Look at this, 0-day confinement in Iowa, Louisiana, Maryland, Michigan, Missouri, Nevada, Pennsylvania, South Carolina, South Dakota, Tennessee, Texas, Utah, and West Virginia. Those states have 0-day confinement. So you don't have to worry about that prior hospital stay. You can start receiving them home health care benefits day 1 in all of these states. So make sure when you're dealing with a specific state, if you write in multiple states, just make sure you're knowing if it's one of those 3-day stays or if it is that 0-day confinement, because this is a big plus in all of these states here that they don't have to worry about. So that is the home health care aid benefit. So what is covered underneath the home health care policy? Again, it's up to that $150 maximum daily benefit, and it's these skilled services. So if you have a skilled nurse or RN come to your home, Kemper will pay you $75. Now, because it's an indemnity plan, even if you have that RN come in and she came in for a couple hours, but she only charged $50, Kemper's still going to give you that $75, okay, because it's an indemnity plan. General nursing care, which is LPNs or LVNs, would pay $60, physical therapy $75, speech pathology $75, occupational therapy $75, chemotherapy services are $60, and so on. So these are the services that are covered underneath this home health care policy. Now, when they say that it's a maximum benefit of up to $150 per day, how you maximize that $150 a day is by having a combination of these services. So for example, if you had that RN come into your home and you had that occupational therapist come into your home, they both pay $75, so those 2 services would get you up to your maximum daily benefit of $150. So that's how that works there. Of course, if you only had the RN come in, you're only going to get $75 that day and of your 150, and then but that is a day gone. So it is best to combination or build up those services and kind of have them on the same days if it's at all possible to get you up to that daily maximum benefit. And remember, if you do purchase 2 policies, you can double this by getting up to $300 with having 2 policies. The next feature on the home health care plan is the built-in RX drug benefit, or the prescription drug benefit. Now, this first prescription drug benefit works like this. You have a $50 deductible, and then Kemper is going to pay 80% after that deductible, up to a $250 yearly return. So let's take a look at an example here. We've got a prescription for a nasal spray, and you can see this retail drug cost is circled. That's because Kemper goes by the retail drug cost when they're determining your 80% and your deductible here. So this first nasal spray is $212.99. The second nasal spray, the retail price is $108.99. And the Z-Pack here is $51.99. You add up those 3 prescriptions for a total retail cost of $373.97. And then what Kemper will do is subtract out your $50 deductible, and then after that deductible, that retail cost here is $323.97. They'll then multiply that by 80%, and that brings it to $259.18, which you've already reached your max return for the prescription drug benefit of $250. And they can do this each and every year. They can get a $250 prescription drug benefit every time. However, whoops, let me go back here. Sorry about that. There is a little difference in a few other states. We have Louisiana, Maryland, Nevada, Pennsylvania, South Carolina, Tennessee, Utah, and West Virginia. Those states have a little different wording on their prescription drug. So instead of having this $50 deductible and pays 80% of that, up to $250, in these states, they're just going to give you a flat rate of $25 per prescription, up to a $300 max. So you get $50 more than this other one. However, it might take you a little bit longer in these states to get out that full prescription benefit. So here we've got 3 prescriptions. It's going to pay out $75. So yes, you might have to send in a few more prescriptions, but remember, even if you have the same prescription, as long as you're filling it on a monthly basis, that can be turned in every single month, or you can wait and build them up however you want to do to get out that full $300 maximum benefit. So again, some of the states do word that prescription drug a little bit differently. Both are great in the fact that you can really reduce your overall annual premium cost by either the $250 or the $300, depending on what state that you're in. This is just a closer snapshot and how on the 50% deductible, or the $50 deductible with the 80% prescription return, look at this one retail cost is $449.89. You can see in those states where just one single prescription is going to get them that full benefit return of $250 prescription drug benefit. So it could be as simple as one prescription taking care of that, or of course, if you're in those other states, you're going to have $25 per prescription that you fill. So just wanted to show you how easy it is that even just one simple prescription could get you that full $250 return. So let's take a look at how affordable this plan is. We have ages 65 to 70, and for the basic plan, that annual premium is $338.95. Now, if you got that $250 RX drug benefit returned to you, your annual cost actually is reduced to $88.95 or $7.41 monthly. That is a great savings when you get that reimbursement for the prescription drugs and really bring down that overall premium cost to your clients. And you know what? We all know when we're dealing with older seniors that most of them do have some prescription drugs that they can go ahead and get this great prescription drug benefit reimbursement. So again, it brings down that overall net cost of your premiums. So not only do you have a full 1-year home health care only plan, but you also have a great RX drug benefit as well. So now we've talked about the basic home health care benefits and that prescription drug benefit. So let's take a look at some premiums here. Now, this is the basic home health care benefits that we just spoke about. So you're getting that up to that $150 a day, the home health aid benefit, and the prescription drug. And you can see with their benefits or their rates that it's the same premium whether you're 41 all the way up to age 55. All the rates are exactly the same here. Now, if somebody in that age group buys a policy, their cost per day is only 78 cents a day. And if we go up to age 65 to 70, that net cost is only 94 cents per day. So you can see it's very affordable for all ages with the Kemper home care plan. One thing I do want to note is that premiums do go up with age. So for example, if you sell someone today that's age 60, their premium is going to be $24.05 a month or $288.70 a year. However, when they turn 61, that next policy anniversary, their premium is going to go up to $28 monthly or the $335.65 on their annual. So just note that every 5 years your rates will go up, and it's all laid out right here in the brochure. So you can actually show your clients what the rates are going to be in all the subsequent years for as long as they have their policy. So it's all laid out right there. But I just wanted to stress that just so you know to tell your clients that those premiums do go up in each of those age-banded areas. So now let's take a look at the optional benefit riders. Now, if you decide to take the optional benefit rider, it includes 5 additional benefits. The first one is the annual physical exam. Now, the annual physical exam is you have to wait until at least 12 months after your rider's effective date. So you do have to wait 1 year before you can claim on the annual physical exam. But for that, they're going to give you $150 for that exam. This exam is limited to 1 time a year, and provided that you haven't had any other benefits underneath the rider in that 12-month period. So basically what they recommend is when you file a claim, file the annual physical claim first. So once you file that claim first, you get that $150, then you can go on to the other benefits throughout this optional benefit rider. The next one being the vision benefit. Now the vision benefit is going to pay $40 for an eye examination, and this is effective after 6 months after the rider's effective date. And then if you want lenses and frames, it's also a 6-month wait after your initial effective date, but they will give you $75 if you purchase prescription lenses or eyeglasses and so on. The next benefit that's included in the optional benefit rider is the hearing benefit. So if your clients have hearing aids or they have a hearing exam, they can get a $50 rebate for their examination. And then if they actually purchase hearing aids, they can get $250. Again, both of the hearing examination and hearing aids is effective as long as the policy's been in effect for at least 1 full year. The next benefit here is the ambulance trip. And the ambulance is going to basically give you $100 for each ambulance trip to a hospital and a return trip home. And that's going to be a maximum payout of $200 in any 12-month period. The last benefit underneath the optional benefit riders is the in-hospital private duty nurse benefit. Now this benefit is going to pay $80 for each day that you're confined, up to 30 days in a 12-month period of time. And the main thing is to know is that this benefit is not payable to a nurse who is a member of your immediate family. So you can't have any immediate family be taking care of you, but an in-hospital private duty nurse would pay $80 up to 30 days per calendar year. So now if you purchase the home health care policy with the optional benefits, you're going to get that first bucket, which included all the home health care basic benefits. You're going to automatically get that prescription drug benefit. And then that bucket number 3 is the home health care optional benefits, those 5 additional benefits we just went over. So now let's take a look at the rates for that program. Now, the home health care with the extra benefit rates, again, 41 to age 50, those are all the same rates. It's as low as $116 per day. And we always kind of go back to that age 65 to 70 age category. This is only going to cost about $1.34 per day. So again, very affordable even with the home health care with the extra benefits on the home health care Kemper plan. Even take a look at this. It even gets better. So this $481.35 annual premium, if they access that full $250 prescription drug benefit, if you subtract that out, then their net cost was only $231.35 a year, or just 64 cents a day is all it costs your client to get a home health care with the extra benefits plan. So you can see this plan is very, very affordable when you're selling it out there in the field. Now, how do you access benefits for all these benefits I just spoke about? Well, the first thing is you cannot perform 2 or more of the activities of daily living. Those are eating, bathing, dressing, toileting, and transferring. So again, it's 2 or more of the ADLs that you're unable to do or have a cognitive impairment, whether it's Alzheimer's or dementia. Those are the benefit triggers of the policy. You can see that the ADL one, it's not a long-term care policy, so you don't need to have that 90-day certification like you do on a traditional long-term care. This is much easier because you don't have that 90-day. It's just right off the bat, if you're unable to do those 2 or more of the ADLs, you can qualify to receive the benefits. The next feature here that's built in is the restoration of benefits. Now, the restoration benefits is a nice little provision that if you do use some or all of your maximum benefit period and you recover enough to where you no longer receive home health care or you don't need a home health care aid for at least 180 consecutive days, and that your physician certifies that you no longer need that care, the company will restore all those benefits back into your policy. So then you can reclaim on it all over again. And there's no limit to the number of times that this policy can actually be restored. But it's very similar to a lot of the restoration of benefits out there. You just have to recover enough. If you recover and you're free from care, those benefits restore. So it's not something where a family member could step in and just take care of you while your policy is restoring. If you still need the care, the restoration's not going to kick in. But that's very standard in the industry. So now that we went over all the benefits, which I know I kind of seem to be quick, but that's what it is. It's a very simple, straightforward policy. It's a standalone home health care only policy. Now let's see how easy it is to apply for that plan. So the first thing you want to do is make sure you have the correct application. And Kemper Health has 2 different policies. They actually offer a guarantee issue whole life only plan, as well as this home health care indemnity only plan. So basically what you want to do is just make sure you have the correct application, make sure it has the home health care indemnity policy on it, and then you're good to go. Make sure your form numbers are current, and then you're off to the races. Now what's nice about this is it's only a 2-page application, so it's very, very simple, and I'm going to show you just how simple that is. The first section, of course, is just your applicant information, name, address, and so on. The next section is what they refer to as their underwriting section, and it's very, very small, which is really, really nice when it comes to making people get the coverage because there is such minimal underwriting. Most people can qualify to get this home health care plan. So the key questions here are questions 2, 3, and 4. Now, this question 2 says if you answer question 1 to yes, basically, if you intend to replace your home health care coverage and you mark yes here, you can't buy this plan. They don't want replacements. You don't want to replace anything. So again, you don't want to replace this plan. The second one, are you currently living in a nursing home or assisted living facility or currently receiving home health care or similar type benefits? So obviously, they don't want you if you're already a claim waiting to happen, right? And the number 4 here, are you physically unable to perform routine activities such as bathing, dressing, eating, toileting, or transferring to or from bed or chair? Again, if you answer yes to questions 2, 3, or 4, stop. Do not submit the application. It will be declined. Otherwise, if you answer all these questions no, you pretty much can guarantee you've got yourself a policy in force. So the next section here is the payment mode. You can see that Kemper only offers 2 different options here. They offer an annual pay as well as a monthly automatic bank account withdrawal pay. So it's only 2 options here, annual or monthly. The next page is the agreements and signatures. And the first thing we want to look at is when you want the coverage effective. Now, if your clients are paying on an annual basis, it's always going to be the date of the application. If your clients are paying monthly, it's going to be determined by the home office, and it's going to be the date of issue. Now, there is an other section here, and that's if your clients want to choose what day that draft comes out. They can do that by choosing other and then putting the 15th of the month or the 21st of the month or whatever they want to do there. So that's what that other is for. Another unique situation here with Kemper is that they can actually deliver the policy directly to the applicant, or if you as an agent want the policy be mailed to you, they can send it to you. But you've got that option with the home health care plan is to have that policy be delivered directly to the applicant. So whichever you choose up here is how Kemper will handle that. The next area here is the signature of applicant, owner, or trustee. This is somebody who wants to get coverage. Maybe they have a power of attorney and they want to get this policy for someone who is probably going to need it, right? You can still do that. You do have to provide the power of attorney paperwork, and this is where they're going to sign on that line. The next area is the bank draft authorization section. Now, a few things here is you always want to determine the legal residence as far as the writing state. So whatever your legal residence is for your client, that's where you want to make sure you're writing that application and that on that application resident paper. The next one is if you are doing a monthly bank draft, you do not need to send in any money. They're going to automatically draft that from their checking or savings account, whichever one they put on the application. The next one here is the bank draft should always, or actually do not select date of application on monthly, which I had noted on the previous slide here. And the next one is if the bank draft authorization should always be completed even when you do an annual pay. Now, an annual renewal will actually come out of the person's bank draft. Kemper will send them out a letter saying that, notifying them that the annual payment will be withdrawn. So that is, it's not like it's going to be a big shock and have that annual premium come out of their bank account. However, they do it that way. One thing I do want to point out, even though it's not on the application, is if you do select an annual, they will do a direct bill too. So if you don't set up the bank draft or the client doesn't want to set up their bank draft, then they must do it on an annual basis and they will get a direct bill at that point. So just want you to know it is possible, but also it is possible that if you want an annual pay, that can also be bank draft withdrawal on the renewal. When you're submitting the application, they do need a check for the annual amount if you're going to do an annual pay with the initial application. So hopefully that was clear. And this is just a sample application. So the next form here that needs to be included with the application is the medical notice. Now this is only needed if you have a client that's 65 or older, but this is basically your non-dupe form for Medicare supplement. It's basically saying that you know that this isn't a Medicare supplement plan that you're buying, and you do have to have both the agent and applicant sign this form. You can send your applications directly to GoldenCare or our sister company, American Independent Marketing, or you can send them directly into Kemper Senior Solutions. The address is listed there. One thing I do want to mention is we have a great new business department here at GoldenCare. They do app scrubbing, and they can basically check through the forms, make sure you're not missing anything. Maybe you want to just use us for the first few times until you get familiar with the application process. Then you can start sending them direct into Kemper, however you prefer. But you know what? Our new business team is a wonderful group, and they can scrub the apps and just make sure that everything's in line before it gets submitted to Kemper. So take advantage of that service. That is one of the things that we have here at GoldenCare that can really help you when you're writing insurance out there. Finally, the state approvals. This is the map of where Kemper is. All the blue states are where the product is currently approved. Now, we do have some green states here. Those are all pending. You can see Florida, it shows grade. It has been filed, but you can see by all the states with the little asterisks here, we have our educated guess is basically a long shot. Unfortunately, there's some states out there that are just tougher on these smaller ancillary products, and so some of the states just won't approve products like this. And it's unfortunate because the home health care only plan is a great little plan, especially when a client is uninsurable for traditional long-term care, and they do want some of that coverage to keep them at home and pay for that kind of coverage. So again, this is the plan map for the approval. And finally, that brings us to the AIM and GoldenCare map. Like I said, our sister company out in Yakima, Washington, it handles all of the yellow shaded states, and we here at GoldenCare USA, I am right here in Minnesota, and this we handle all the states in red. But again, you can call us no matter what state you're in. We will help you. That's what we're here to do. And again, if you're not contracted, give us a call here at 800-842-7799, and we will be glad to help you. But again, I want to thank you all for attending here today. I'll stick around. If anyone has any questions, you can certainly type those questions in, and I'll get to them. But otherwise, I encourage you to give us a call here at GoldenCare at 800-842-7799. Also, check out our website. We've got lots of resources and tools for our agents. We've got a host of other products, as well as our LTC CEO selling tools. We've got GoldenCare rewards programs for our agents who write business. We've got our StrataCision comparison tools, discounted E&O, Care Options Health and Wellness Hub, which is a great lead and referral tool. So again, take advantage of going through GoldenCare. That's what we're here to do, is help you write more business. So thanks, and have a great rest of your day.